Hi, welcome. Today, we are going to be talking to researchers at Birmingham University to talk about the very exciting upcoming IIH Advance Research Trial. All the questions that people will be answering today have been submitted by people living with IIH via the IIH UK social media channels. Any links that people talk about today, we will be sharing alongside the video. But if you have any questions, do please contact IIH UK. I'm Amanda Denton, so I'm one of the trustees of IIH UK and the research representative, and I will be asking the questions today. And I'm going to now ask everyone else here to introduce themselves, starting with Professor Sinclair.
Thank you for the opportunity to come and talk with you, Amanda. I'm Professor Sinclair. I'm a professor of neurology at the University of Birmingham, and I work as a consultant neurologist at University Hospital Birmingham. And I'm the chief investigator, which means that I lead the IIH Advance Trial, which we're going to tell you a little bit more about in a minute. And I'll hand over to my team, starting with Dr. Langer.
Hi, everyone. I'm Dr. Maria Lange. I'm one of the clinical research fellows on the IIH Advance Trial. So this will mean that I do a lot of the day-to-day running of the trial and a lot of the participant-facing work. I am also an endocrinology doctor, and yeah, that's about it. Jessie, you wanna?
Hi, I'm Dr. Jessie Gu. I am also one of the clinical research fellows, and I am also a neurology registrar. I'll be involved in the day-to-day running of the clinical trial as well, and we'll be doing the clinical contacts with you. And now hand over to Miss Smith.
Hi, I'm Miss Smith, and I'm a research associate here at the University of Birmingham, and I'll be helping to deliver the trial.
Lovely. So, to start us off today, can I ask Professor Sinclair, would you be able to tell us a little bit more about the IIH Advance Trial?
Certainly. So the IIH Advance Trial is looking at how a weight loss medication called Mounjaro can affect men and women with idiopathic intracranial hypertension who have papilledema. The trial will be done using mostly video online calls, with very limited need for patients to do visits outside the house. In fact, the only visits that they're going to need to do face-to-face will be to have their vision assessed, and that's going to be done at your local Specsavers store. Everything else is going to be done at home through video consultations with our team here in Birmingham. And you'll be in the trial for between 6 and 18 months. And if you want a clear video explanation, do have a look at our website. We've got a nice video to talk you through the trial to explain how it all works.
Could we ask Dr. Langer to tell us a little bit more about what being involved in the trial would involve? What does someone have to do?
Sure. So again, I think looking at that video will be very helpful because it's quite visual, but just to explain, so the trial has 4 stages. The first stage is the screening stage, where we will be checking if you are eligible to take part in the trial, and this will last about a month or so. Then in the second stage, which will last 6 months, you will either be allocated into the group that receives Mounjaro or just have your usual NHS care. In the third stage, if you continue into this stage, then again, you will either continue in usual NHS care or receive Mounjaro. The last stage, the fourth stage, again lasts 6 months. And if you have not yet taken Mounjaro for the previous 12 months, you will be able to receive it at this stage. As part of the trial as well, we will be sending home collection kits where we will be asking you to take samples of your saliva, your urine, your poo, and also a finger prick blood test. If you're at all apprehensive about this or want to know a little bit more, on our trial website, we also have really good explanatory videos of exactly what will need to be done. So have a look at that if you want a bit more of an explanation. You will also have monthly video calls with us and then up to 4 visits to your local Specsavers. And in order to stay in the trial, you must attend all of these visits with us.
Could I ask Dr. Gu, what is the goal of this research trial?
Thank you for the question, Amanda. So the aim of this research trial is to enhance care for people living with IIH by exploring the evidence for using weight loss medications and influencing future healthcare policies. For example, if in this trial we find that Mounjaro is beneficial for patients with IIH, then the results will be evidence that could change the treatment and policies on treatment for patients with IIH. The evidence might be useful in changing guidance and policies and on who can access weight loss medications on the NHS, which currently does not include IIH. So our goal is to ensure that future patients benefit from improved treatment options. And clinical trials in IIH are rare, as they are in many uncommon conditions and compared to more common disease conditions like cancer or diabetes, and securing research funding can be challenging. So this makes this trial a valuable and unique opportunity to work collaboratively to generate evidence and shape future care. We're especially grateful to the patients who are partnering with us to make this progress possible.
Thank you. Dr. Langer, how will they know, or how will you know, if it's the weight loss or if it's the Mounjaro, seeing as another trial showed GLP-1 was shown to lower intracranial pressure within 4 hours?
Okay, that's a really good question, actually. Thank you. So from previous laboratory research that has been done, it has been shown that GLP-1 receptor agonists can directly reduce the brain fluid production and therefore reduce brain pressure. Now, we suspect that probably Mounjaro will be predominantly working by reducing weight in the participants, and that through that mechanism, it will be supporting the condition. It might also potentially have a direct effect on the brain fluid production too. However, it's quite unlikely that Mounjaro will have a rapid effect on this. I think the question probably relates to a previous trial where a different GLP-1 receptor agonist was used called exenatide, and this worked much faster than Mounjaro. So we really wouldn't expect the same sort of rapid drop in brain pressure with Mounjaro.
Thank you. That's really interesting. It's a really good question. Dr. Gu, could I ask you, is the trial only open for people who are currently taking medication like acetazolamide or topiramate?
No. So in order to be eligible for the trial, you do not have to be taking any current medication for IIH. Equally, if you are taking any medication for IIH, that will not stop you from participating in a trial. The most important eligibility criteria is that you have active papillary edema, as this will allow us to measure the change in intracranial pressure through the OCT scans. And this allows objective measurement for us to assess if Mounjaro improves outcomes for patients with IIH.
That's really interesting, and thank you for clarifying why having papillary edema is so important. Dr. Gu, can I also ask you about, can you be part of the IIH Advance Trial if you have other health conditions as well as IIH?
Yeah, so this will have to be assessed on a case-by-case basis. So depending on the individual conditions and their past medical history, for instance, we cannot include someone who hasn't had a medical condition called pancreatitis, as that is a contraindication to Mounjaro. So minor health conditions are usually fine for this trial.
Thank you. Dr. Langer, does someone on the trial have to follow dosages given, or can they titrate to the highest tolerable dose?
Okay, so within this trial, the aim will be to get each participant to the highest dose that they can tolerate. So if they are able to tolerate the medication, we will be titrating them as fast as possible. And the fastest way to titrate somebody is to do a dose change every month. So everybody will start on 2.5 milligrams. They will continue that for a month. At the end of that month, we will assess how they are feeling and if they can go up to the next dose. So then for another month, they'd go up to 5, then for another month, 7.5, then 10, then 12.5, and if they're able to, up to the maximum dose of 15. So every month we'll have a call to make sure that the participant is feeling well on the medication and assess whether they can go up to a higher dose. We will also be giving advice on these calls on managing side effects and just making sure that the participants are well.
That's great, thank you. Dr. Gu, can I ask you about whether the local neuro-ophthalmology team to that person is involved. So in particular, could they still get tests and their OCT scans as they would normally?
Yes, absolutely. So all the standard care will continue as normal with the participants' usual care team looking after the IIH and will inform the doctors that they are in the trial and the trial will not responsible for monitoring or looking after the participants' IIH. The trial will collect the research data and that will include arranging for them to have their OCT scans at the local Specsavers. However, that should not interfere with their standard care.
That's great, thank you. Dr. Langer, when is the trial starting?
So we don't have an exact date yet of when we are going to start recruitment, but we're hoping that this will be at the end of November. But in preparation for the trial, we've set up a lot of social media platforms, which will be advertising our launch date. And this is across Facebook, Instagram, TikTok, and YouTube. So I would suggest following all of the platforms or whichever platform is your favorite. And on these, you will be able to hear about the most recent updates, when we're going to launch, and we're also posting some educational content about the trial and explaining bits about who's involved in the trial and the team, so you see some familiar faces. IIH UK will also be sharing some of our posts and also updating information about when the trial is launching. So if you prefer following their accounts, that's also absolutely fine. And you can find the handles to our social media on our website, which we will be posting with this video. So if you just follow through to the website, you'll find our handles easily.
Great, thank you. Dr. Gu, is there any information that I can share with my IIH team at the hospital?
Yes, you can direct them to our website. And as Dr. Langer mentioned earlier, the link will be posted together with this video recording. So on that website, that should have the information that the team needs.
Thank you. Can I also ask you, will people be able to take part from across the UK? And does that include Northern Ireland?
Yes, so the trial is UK-wide and that includes Northern Ireland.
Thank you. Professor Sinclair, can I ask you, there's been things in the press and in the news about limited availability issues with Mounjaro in the UK. Is that going to be an issue for the trial?
Oh, I just needed to unmute. Yes, there's certainly been a lot of discussion in the news recently about Mounjaro, and I think that's probably going to continue with lots of discussion going on over the next many, many months because it is such a hot topic. There are restrictions on supply in some areas, and there are changes in price going on, and I think that's very fluctuant at the moment. But we have secured our supply of Mounjaro for this trial, and so we are not concerned about it. And the patients in this trial are not going to be required to pay for Mounjaro. So the price fluctuations that you're reading about in the press will not affect participation in our trial.
That's great, thank you. Dr. Langer, can I ask you if men can take part in this trial?
Yes, absolutely. So we're quite excited that the trial is open to both men and women, but importantly, it's only open to adults, so people over the age of 18.
Thank you. Dr. Langer, can I also ask you, if you are currently on weight loss medications, can you still take part in this trial?
Okay, this is actually a really important question. So if you are currently on weight loss medication, then the answer is no, you cannot take part in the trial. If you have previously been on weight loss medications, you will need to be off of them for at least a minimum of 4 weeks. But I think what's important to recognize here is that the really important eligibility criteria that we mentioned is having evidence of the optic nerve swelling of papilloedema. So it may be if you have been on these weight loss medications for a period of time, that this has actually resolved any papilloedema that you had already. So it may be that when we're screening you and you have an OCT scan, if this doesn't show evidence of papilloedema, you won't be able to enter the trial, even if you haven't been on the medication for several months. So it's just, I think it's important to bear that in mind.
That's great. That's really helpful. Thank you. I know that's a question a lot of people will be asking. Dr. Gu, can I ask you about how long will Mounjaro be offered to participants on the trial, and what criteria will determine that variation for an individual person?
Yeah, that's a very good question, actually. So almost everyone in a trial will receive Manjaro at some point, unless after 6 months the IIH has recovered and the papillary edema has completely resolved, as they will no longer need treatment in this scenario. So everybody else will receive Manjaro. Most people will receive the Manjaro for 6 months and a smaller proportion for 12 months. And some people will receive it straight away, while others have to wait for 6 or 12 months. And they have to attend a video call every month to remain in the trial and be eligible to receive the drug. And it is also very important that after they have received the drug, they remain in a trial for the rest of the time period, so we can assess what happened when they come off the medication. There are no criteria that determined this variation. So a computer randomly determines if someone get the drug or not, and whether someone receive it or not. So, and I think the participants really need to be prepared to accept this uncertainty if they come into the trial.
Thank you. That's really helpful. Dr. Langer, can I ask you, will people be able to self-refer for the trial?
Yeah, absolutely. So I think this is one of the ways in which the trial is quite novel. It's in the fact that you are able to self-refer. So once we are open for recruitment on our website, you will be able to complete an expression of interest form. When you complete the form, it will also prompt you to say that you will need to show evidence of your IIH diagnosis. So prior to the first appointment with us, you will need to be able to show us a clinic letter from your diagnosis, and ideally also a recent clinic letter from your neurologist confirming that you have IIH. Now, you might already have a paper copy of that you've previously received. If you don't, you can get back to your doctors to ask them to provide you with a paper copy, or also if you have your NHS app, you might be able to find your letter on there. So just bear this in mind, that that's something you'll have to be able to show us. We will also, as previously mentioned, need to confirm that you have papilledema. So once you pass the first stage of the screening, we will arrange for you to have an OCT scan at your local Specsavers. Another important criteria as well is your BMI, which is your body mass index. And this needs to be, in most cases, at least 30, and in a few cases greater than 27. So a very quick way that you can assess your body mass index, which is a way of measuring if you're in a sort of healthy or overweight or obese range with regards to your weight, is using a calculator. So it's measured by weight divided by height squared. But I'd probably suggest just Googling NHS UK BMI calculator, and then you can just pop in your numbers and then it will give you the calculation.
Thank you. Dr. Good, can I ask you about, will people be offered dietary or psychological support when they're taking the drug and in the trial?
Thank you, Amanda. So the answer to that question is no. We cannot introduce a structured lifestyle intervention as that would alter the results of the trial. And we will, however, provide a high standard of care in line with the NHS practice. So the participants on Manjaro will have monthly calls with us, with one of the members of our research team, who will offer support, give advice with regards to managing the side effects and how to make the most out of Manjaro, and be on hand to answer any questions related to Manjaro.
That's really helpful. Thank you. Dr. Langer, what happens if someone on the trial doesn't get Manjaro?
Okay, so I think as Dr. Gu has mentioned already, almost everybody who enters the trial will receive Manjaro at some point. So the only circumstance in which you enter the trial and don't receive Manjaro is if you haven't received it for the first 6 months, and then your papilledema completely resolves with the treatment that you're normally having in the NHS, because in this instance, you would no longer need the medication and you would exit the trial at this stage. But during the time when you are not on the medication, we would be really grateful if you chose to remain in the study with us. So your contribution to the trial when you are not taking Manjaro is really just as important when you're on the medication. So in order for us to really be able to prove that Mounjaro improves outcomes for people with IIH, it's essential that we can compare a group that receive it straight away versus a group that hasn't received it from the beginning. And this comparison is really what makes our research strong and reliable. So even in the period when you are not on the medication, you will still need to attend the monthly calls with us in order to continue staying in the trial and then to be eligible to receive the medication in the future.
That's great.
We of course really, appreciate that taking part is a really significant time commitment, particularly if, you're not receiving the medication for a period of time. But we're hoping that because this trial is delivered online, we can try and be as flexible as possible, with arranging the calls with you. You won't have the added time of having to travel for these monthly calls. And importantly, even if you don't receive Mounjaro in the first 6 months, then hopefully within the next 6 to 12 months, you will have the opportunity to receive the medication. And yeah, I mean, your involvement is really vital in helping us move research forward. So we would really love to collaborate together so that we can improve care for patients with IIH.
Thank you. And Professor Sinclair, the last question's coming to you. Can I ask you, what are the benefits of taking part in this research trial?
Thank you, Amanda. And I think that's really building very much on what Dr. Langer has just been saying. Benefits of this trial will be very broad. So you may be able to help treat other patients with IIH in the future. And we'll understand from this trial much more about the use of anti-obesity medications in IIH. And by gaining that knowledge in a really robust and scientific way, we will be able to influence future care. We will be able to potentially change guidelines. We're able to potentially change policies. And this can influence prescribing practices and, in general, how doctors will treat patients in the future, both in primary care and through the hospital setting. So it's only really through these types of research studies that we can make those changes in patient care. But I would also add that for the individual who, as we've heard, may have to give up quite considerable time to be part of this study, it's also evidence that patients that are in clinical trials, by the sheer fact that they're seen regularly by healthcare professionals, they usually end up with better healthcare outcomes than patients not in trials. So we have that additional benefit of just being in a more monitored environment with access to healthcare staff. So it benefits for the individual, but also benefits more broadly for other patients with IIH and for future policy decisions, because we'd like to be able to really make a change for the future for patient care.
That's great. Thank you to all of you for asking the questions of the IIH community about this exciting new trial. And I know we're all going to be watching the social media and the trial website, and we'll be sharing all those details both on the IIH UK social media, but also alongside this video. And really can't wait to hear how the trial gets started and how it goes. So just an enormous thank you for doing this research, and we really can't wait for it to get started. Thank you,
Amanda. And thank you for working with us for this one, because this is a very unique trial. Usually the trials run through the healthcare professionals in the hospitals, and we're reliant on other hospitals and other doctors to help us recruit. But this trial is really very different. We're going to be relying very much on the patients with IIH in the UK to recruit themselves. So we look forward to hearing from people who meet our eligibility criteria.
Fantastic. Once again, an enormous thank you on behalf of IIH UK and the IIH wider community. Thank you.